So students, today we will learn about dentine. As we know that it is a mineralized connective tissue component of the tooth, and the largest, or it forms the main bulk of the tooth and is located between the pulp and the external surface of the tissue. Dentine is covered by enamel in the crown and by cementum in the root region. Okay. Now today we will first we will study about the physical properties. The dentine, it is light yellow to yellow in color. It has a loose hardness number of approximately 68, and dentin is much softer than the enamel, which has a enamel has a loose hardness number of 343. This explains why the dentine exhibits much faster wear than the enamel. Third is the compressive strength, 40,000 psi units, and dentin is considered to be highly permeable because of the presence of dentinal tubules in it. Okay. Chemical properties. Now, dentist, by weight, it has 70% of inorganic components, 20% organic components, and 10% of the water. By volume, it has 45% of inorganic component, 33% of organic, and 22% of the water. The inorganic portion mainly consists of calcium and phosphate in the form of hydroxyapatite crystals. Small amounts of carbonate, calcium, sulfate, calcium hydroxide, and trace elements are present such as zinc, iron, fluoride, copper. 82% of the organic components of dentine is composed of type 1 collagen. Okay. In addition to the dentine matrix, the dentine also contains proteins and proteoglycans, which are referred to as non-collagenous proteins. These non-collagenous proteins in dentine are phosphofirins, dentine matrix protein 1, and dentine sialoproteins. These non-collagenous proteins participate in the initiation of dentine mineralization and controls the growth of the apatite crystals. Now first, coming to the dental tubules. The dental tubules, they are the basic structural and functional units of dentine. They are tubular or canal-like branch structures extending from the pulpal end to the dentinal enamel junction. Dentine is composed of numerous dental tubules which contain protoplasmic processes of the odontoblasts. Some of the characteristics of dental tubules are the dental tubules, they do not follow the straight course, but they have a curved course. In longitudinal sections, dental tubules have a S-shaped curvature. These S-shaped curvatures, they are described as primary curvatures. The first convexity of the primary curvature from the pulpal side is in the apical direction, and the second convexity is towards the crown. The third path is more clearly evident in the coronal and the cervical region of teeth. In radicular dentine, the curvature is less distinct and may be even absent. So they are more or less they are straight in the root part. When dental tubules are observed under higher magnification, higher magnification, they also show minute undulations or a wavy course along its length. These are referred as secondary curvatures, which may be the result of spiral course taken by the odontoblast as it moves pulpally during the dentine formation. Dentinal tubules, they show a wide-shaped terminal branching near the dentino-enamel junction. The branch fork often at an angle of 45 degrees. These extensive terminal branching and looping of dental tubules, they are also seen in the root dentine. Dental tubules, they show lateral branches along its course at a distance of approximately 1 to 2 microns. These lateral branches, they are of 1 micron diameter and are almost 45 degrees to the main tubule. These branches, they may contain odontoblast process and they may communicate with those of the adjacent ones, or they end blindly in the intertubular dentine. The density of the dental tubules is more at the pulpal end and is than near the dentino-enamel junction, with more number of tubules per unit area at the pulpal end when compared at the periphery. In transverse section, dental tubules, they are seen as circular space surrounded by a hypermineralized zone of peritubular dentine. Dental tubules, they contain odontoblast process. They also contain non-myelinated nerve fibers and dental leaf. The dental leaves contains few collagen fibers, apoptotic crystals, and plasma proteins. Now the odontoblast. In a vital tooth, the odontoblasts, they are arranged as a continuous layer along the periphery of the pulp, adjacent to the pulpal surface of the dentine. Each cell has a protoplasmic process, as you can see in the diagram. Each cell has a protoplasmic process that extends for varying distance into the dentinal tubule. These extensions, they are referred to as the odontoblastic processes and are the major content of the dental tubules. These processes, they are of approximately 3 to 4 microns in diameter at the pulpal end and taper to 1 micron near the periphery. Each process has many fine branches all along its entire length, and they lie in the corresponding lateral branches of the tubule. The odontoblastic process, they contain a fine network of microfilaments and microtubules. Cytoplasmic organelles such as ribosomes, endoplasmic reticulum, mitochondria, lysosomes, and microvesicles are they also seen in the odontoblastic process. Presence of vesicles indicate a secretory function of the odontoblast process and is responsible for the formation of peritubular dentine. The distance to which odontoblast process extend into dentine is subjected to much research. However, recent studies have confirmed that their presence up to the outer surface of the dentine till the dentino-enamel junction, but they do not follow a regular pattern. In certain region of the tooth, these processes may extend beyond the dentino-enamel junction and they may remain calcified in calcified enamel and they are referred to as enamel spindles. As you can see the transverse section of the dentine. So the main bulk is formed by the intertubular dentine. In between the intertubular dentine, you can see the round structures. These are the dentinal tubules with the center part containing the dental tubules, and around it we have a peritubular dentine, which is also called as the intratubular dentine. The dentino-enamel junction, the junction between the dentine and the enamel, is the dentino-enamel junction with the concavity facing towards the dentine and convex with the concavity facing towards the enamel and convexity which is facing towards the dentine. So this and it is scalloped in it is a scalloped structure. So this scalloped structure, it helps in increasing the strength between the enamel and the dentine. Next is the predentine. The pulpal surface of the dentine is lined by a layer of mineralized dentine matrix. This layer is comparable to osteoid of bone and is termed as predentine. The predentine layers varies in thickness between 2 to 6 microns or even up to 20 microns depending upon the odontoblastic activity. This is the mineralizing front of the dentine and is always present throughout the life of the vital tooth. This layer always exists between the mineralization process and lags behind the matrix deposition. Sorry. This unmineralized pre-dentine layer acts as a protective layer separating odontoblast from the mineralized dentine. Presence of this layer also has a functional significance because it covers the mineralized dentine and protects it from being resolved. In a decalcified section, pre-dentine layer appears pale in color compared to dark pink colored mineralized dentine. Next, the primary dentine and the secondary dentine. Primary dentine. It is the physiological dentine that is formed till the root formation is completed. This primary dentine forms the major part of the dentine. Now, it has two different types. One is the mantle dentine, second is the circumpulpal dentine. First is the mantle dentine. This is the portion of the primary dentine found at the outermost portion adjacent to the dentino-enamel junction and the dentino-cemental junction. This is the first formed layer of the dentine and is roughly 20 microns in thickness. This layer extends from the dentino-enamel junction up to the zone of interglobular dentine. This layer is different from the rest of the primary dentine in that it has collagen fibers which are of larger diameter, loosely packed and are arranged perpendicular to the dentino-enamel junction. The larger diameter collagen fibers observed in early mantle dentine formation, which are extending from the region between the odontoblast and fanning out to the near the basal region of the amyloblast, they are referred to as von Koss fibers. The ground substance is derived from dental papilla, which lacks phosphorin. The mantle dentine has high organic component and is slightly less mineralized than the rest of dentine. Mantle dentine is better formed with fewer defects. Second is the circumpulpal dentine. The dentine, which is the the dentine, forms the remaining part of the primary dentine, which makes up the bulk of the dentine. Circumpulpal dentine is composed of organic matrix with closely packed smaller diameter collagen fibers, which are arranged parallel to the dentino-enamel junction. The ground substance is also secreted by odontoblast, which contain phosphorins. Circumpulpal dentine is 4% more mineralized than mantle dentine and may show mineralization defects, which are referred to as interglobular dentine. Circumpulpal dentine also include the physiological second dentine. The second dentine. Although at a slower rate, dentine deposition continues throughout the life of the tooth. The physiological dentine is formed after root completion as a part of continuous lifelong deposition of dentine is referred to as secondary dentine. The continuous formation of second dentine reduces the size of the pulp chamber gradually. The rate of the deposition of second dentine is more at the roof and floor of the pulp chamber, causing the reduction in the size of the pulp chamber and decrease in the height of the pulp horns. Then we have tertiary dentination, erosion, cavity preparation, etc. So कट कर दूं बंद हो गई यहाँ से कट करो ना ना ओके ओके कर दूं tertiary dentine, in contrast to physiological secondary dentine, is deposited on the pulpal surface of dentine only in the affected area. चेंज नहीं हो रहा है Resume slideshow. Hmm? करूँ ना? Next, we have sclerotic dentine. The sclerotic dentine, it is also called as transparent dentine. The continuous deposition of intratubular dentine as a result of aging or in response to the tooth wear, such as attrition, abrasion, or erosion, or as a result of dental caries. This dentine with obliterated tubules is called as the sclerotic dentine. As a protective change in the existing dental tubules, the dental sclerosis is observed in the crown region of the tooth. The stimuli may induce an active response on the surface of the odontoblast process, resulting in deposition of organic matrix followed by its mineralization. The apatite crystals are deposited, gradually reducing the diameter of the lumen of the dental tubules, eventually causing obliteration. Dentin deposited is structurally similar to that of peritubular dentin. The sclerotic dentin is formed at the expense of the odontotubular process, which is either retracted or shortened by the loss of its distal extremity. When the dentin deposition obliterates many tubules in adjacent areas, the dentin assumes a glassy or transparent or translucent appearance. This occurs because of the refractive index of this dentin becomes uniform, and therefore this sclerotic dentin is also referred to as transparent or translucent dentin. In ground sections, this sclerotic dentin appears translucent or light under transmitted light and dark under reflective light. Sclerosis is a protective mechanism because dental tubules are blocked, and this reduces the permeability of the dentin. This blocks any irritant stimuli reaching the pulp and therefore may help in extending the vitality of the pulp. Sclerotic dentin as an age change is mainly observed in the apical third of the root, which makes the root apex appear transparent, and this increases with the age. Next, we have intertubular dentin. Interglobular dentin. The interglobular dentin, the mineralization of dentin begins as calcospheric or globular mass. These globular masses, enlarged by peripheral addition of new crystalline and eventually fuse together to form a homogeneous calcified mass. Sometimes few of the globular masses they remain discrete and they fail to fuse with each other, retaining areas of uncalcified or hypocalcified dentin matrix between them. The term interglobular dentin is used to describe these uncalcified or hypocalcified zones that exist in mineralized dentin matrix. Generally, the interglobular dentin has a star shape or they have a curved outlines of the globular mass. This type of mineralization defects are seen in the coronal circumpulpal dentin immediately below the ventral dentin, and this follows an incremental pattern. It is not unusual for the interglobular dentin to extend to the radicular dentin to some extent, especially in the cervical portion. In the region of interglobular dentin, the dental tubules transverse uninterruptedly, indicating that this is purely a mineralization defect and not a defect in the matrix deposition. The dental tubules passing through this zone do not show peritubular dentin covering that portion of the course. While preparing the sections, the organic matrix in the interglobular dentin is lost, and these areas they get filled with air. Therefore, in ground sections, the interglobular dentin appear dark under transmitted light and bright under reflected light. The next incremental lines of dentin, they are called as incremental lines of von Neumann. The dentin formation is a rhythmic process with alternating periods of activity and rest. This cyclic process is registered as incremental lines which are perpendicular to the dental tubule. These are called as incremental lines of von Abner. The dentine matrix is deposited in daily increments of approximately 4 microns per day. The incremental lines correspond to the rest period and separate each increment of dentine that is formed. Since the rate of the deposition vary in different teeth and in different regions of the same tooth, the distance between the incremental lines they also vary. These lines are closer in the radicular region than in the coronal part. During dentinogenesis, the matrix that is deposited for 4 or more days enter into the calcified period at the same time. The incremental lines separating these adjacent bands of matrix calcifying at different times are more prominent and are termed as contour lines of Owen. These contour lines of Owen are hypermineralized areas, and some people believe that these are incremental lines that are accentuated due to disturbance in mineralization. Next, we have Tomb's granular layer. This Tomb's granular layer, it is a layer which is seen in the radicular dentine. It is nothing but the coalescing and the looping of dental tubules near the dentinocemental junction. The thickness of the Tomb's granular layer increases from the cervical region to the apex of the tooth. While sectioning these dental tubules, they are exposed and they get filled with air. Therefore, they appear as small, dark spaces, giving a granular appearance. Under transmitted light, Tomb's granular layer appears dark, and under reflected light, it appears to be brighter structure. Then we have dead tracts. When the teeth they are subjected to they trauma and is sufficient to injure or destroy a odontoblastic process, the death of the odontoblast occurs. In the affected areas, the dental tubules they become empty due to the loss of odontoblastic process. These empty dental tubules they are referred to as dead tracts. These empty dental tubules they get filled with air and in ground section appear dark under transmitted light and white under reflected light. These dead tracts have an inverted cone shape with apex facing the pulpal surface. This is due to the convergence of dental tubules towards the pulp. Dentine in the region of dental tract is less sensitive than those with the tubules containing the odontoblastic process. The affected dental tubules are sealed off from the pulpal end by the deposition of tertiary dentine. Dead tracts are also isolated from the surrounding normal dentine by a layer of sclerotic dentine. Occasionally, dead tracts are also seen in teeth with obvious attrition or other damages. In situations, these changes may appear observed in the cuspal tips and inside the ledges. This could be due to death and degeneration of odontoblast due to overcrowding in this region, and this is regarded as pure age-related change rather than any functional change. So the age changes seen in the dentine are first the formation of second dentine, formation of sclerotic dentine, formation of tertiary dentine, and the formation of dead tracts. Thank you very much.